This is LiveWell Talk on Medicine, Color, Culture, and Equity. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital. Today's podcast is another installment in our mini-series where we discuss topics related to diversity, equity, and inclusion. Returning the podcast today is Dr. Niyati Sharma, Medical Director at Union Point Clinic, Wound and Hyperbaric Center. She's also a member of the medical staff and cares for patients on the hospitalist service. And I'd like to share her journey on becoming a doctor and discuss women in medicine. Welcome back.
Thank you for having me again, Dr. Arnold.
Now, we've done this color, culture, and equity and addressed racial disparities. We've addressed the disparity of men of color wearing white coats. That has been and what that challenges have. But another challenge, I think, this is not to be misogynistic, but I think being a woman and being a doctor is really hard because I don't know about your household. I guess I know your husband very well, so I probably know the answer to this. But mom is never off duty. Kids get sick, the first thing they say is mom. They never say dad. Now, when they're teenagers and they want money, they will go to their dad first. But so the mom is never off duty. So, and I know you have two beautiful children. So could you share the story of how you became a doctor and some of the challenges you faced as being a woman as well as a mother?
Yes, absolutely. But thank you for doing this series, Dr. Arnold. I'm really glad that more and more organizations are recognizing this and addressing this. And I'm lucky to be a part of Unity Point, where they've always looked at the female physicians and given chances and opportunities. But yes, it is, as you said, difficult for women in physician in general. For me, I'm from a small town in India, but I was lucky to have both my parents as physicians. So I was exposed to this profession at a very young age. We used to have our first floor was the mini hospital that my parents ran, and the second floor was where we lived, so it was basically a part of our lives. But then my own interest in biology and human body, which till date doesn't stop to amaze me, was the main push where when I entered into this field. Also, the patient satisfaction that you get from it, I was seeing my parents get that, and that was a big push for me to get into it. We all have challenges as physicians, you yourself, and all other physicians. And similarly, I did my part of my share of the hard work that I did. My story about challenges about becoming a physician in America, coming from India, it actually relates to lots and lots of immigrant doctors who face similar situations. Um, Coming from India, doing my basic medical school training in India, and then coming here and learning not just the content of medicine, but the way to practice medicine, which is completely different, which is beautiful here, wonderful, but it's different. It's something that was the first challenge for me to learn, how to modify that practice ways, and do it the way it's done here. Um, Not just that, actually understanding the community and getting in, and knowing what's important for people here, understanding history, getting like what are the who are the superstars, what movies are common here, what sports people are into, leaving behind the cricket and getting into football. It's, although it's not exactly medicine, but you can't leave these things behind. You still have to understand the community, the culture, and I think that's the best way to practice medicine. That's how you know your people, you know your patients, and you make a connection.
Absolutely.
So so something from very basic, from driving over there is so much different than driving over here. But all of that, and then see, community, culture, and then language. English is our second language. All our education was done in English, but the British, what's prevalent in India is more of a British English, and here the accent was different. So to understand that, to get used to that, and then making sure the people who I'm talking to, my patients, are understanding what I'm saying. That's a little bit of challenge. I still hear people, some patients coming back and saying that we really couldn't understand this. We really couldn't understand that doctor who had this accent. So that and little things, but they get challenging when it's happening every day. There are visa technicalities, which lots and lots of immigrants go through, and it poses a barrier in a lot of our um, different stages of our lives. It's just hard to make good progress with visa technicalities still there. Even like traveling back to my country,
Yeah.
going back there and then coming back, even being like legal immigrants working hard, it's still there is a little bit of uncertainty, like are we going to get back here on time, are there going to be any problems, will everything go okay, will I get my visa thing done on time. So all these problems just get together and they become a one big challenge. I'm lucky to have my in-laws stay with us and help us out, but families who are working, if the husband and wife both are working or physicians, to get that support, that the family support is not there. And in fact, right now, say with COVID, my family is in India, to just stay here and just worry about them not being able to like even meet with them, being, that a lot of people didn't with COVID, but just being so far just across the earth on the other side, that's just another challenge that we face. So we have to work hard to build that first connection with the patient, and also many times we I hear these questions: where are you from? What country? Where's your origin? What country are you from? What's your mother tongue? What's your language actually? What's your religion? And I understand most of these questions come out of curiosity, but sometimes they can make people feel differently. And Dr. Arnold, despite all of this, I never questioned myself to be a physician practicing in US. That was my dream, and here I am. And I would just say, we different skin colors, different cultures, different backgrounds, different accents, but really we're all working on the same purpose, working on improving the health of our society, or people. So as long as the society is welcoming, um, we keep giving our best.
Yeah, that it's two things to follow up to your commentary. Is one, the visa system does not take in consideration, in my opinion, at all the value that physicians from other countries bring to our communities. Um, that has been an eye-opening experience. That uncertainty you talk about. I mean, I'm an American citizen. I work in the same hospital I was born in. So I never have that uncertainty. And having ran the hospitals program and all the friends I've made over my 25 years, I've had physicians that just really get jerked around by the visa system, and it's just not fair on several levels. The next is that it's totally a Midwestern thing, that if you go in and introduce yourself as Dr. Sharma, people, particularly the agriculture and the older people around here, particularly in Eastern Iowa, but they'll say to you, "Do you know Dr. Sharma from Minneapolis?" They want to connect with you, and once they connect with you, then okay, she knows so and so, and therefore now we're connected. It is totally a Midwestern thing, and sometimes people are taken back by it. Like, why would I know this? Just because my last name's Sharma doesn't mean I know that doctor. And I did it one time to. I had a friend that when I worked in research, whose last name was Patel. So then I was meeting this other doctor. I said, "Oh, do you know so and so Patel?" And I'd come to find out that Patel's much like Smith
Yeah,
in
yeah,
India. That
exactly.
there's and so I've even done it myself. I think it's kind of funny, but Tell me about being a mom and being a doctor. What are the challenges you experience from there? Because, like I said, mom is never off duty. Dads get off duty. Moms never get off duty.
Yes, that's true, and there are many different challenges that come along with that. First of all, just the thought of being a mom and being pregnant and carrying that during your initial career, like during the residency, and then as I started working, it's a challenge in itself because sometimes it's perceived as, or maybe some women perceive it that it can be a threat to their career. So sometimes women end up delaying their pregnancies, which is not good because there's so many years of training and schooling already, and then you get to the stage where you're starting your to work as a physician, and then you're scared that it's going to affect how, first of all, you won't have enough time to care for your baby, and then secondly, how you will be perceived at workplace if you're taking time off. That's one thing. Then yes, constantly, every morning, having to think about what we are packing for lunch, and who's gonna pick up kids, who's gonna drop them to school. Oh, it's a day off today. Now who's more responsible to take a day off with them? So it's a constant struggle. Bringing up kids is not easy for anybody, but I've realized that being a working mom and a physician mom, if I didn't have all the support that I have, which I'm lucky with my husband, my in-laws, and my neighbors, to tell you the truth, when my in-laws are not there, I rely on my neighbors a lot. And that's Iowa, that as a community and neighborhood has given me a lot and a lot. So yes, it's hard. There's always a guilt, the mom guilt. You go into leadership roles and you go into your get immersed into your profession, and then you have a guilt that I'm not doing enough for my kids. That's always there.
Well, I happen to know that you're a wonderful mother and you have beautiful children.
Thank you.
Two beautiful dogs now, right? You guys have
I
two puppies, right?
Yes,
Yeah,
yes, I
yeah,
have two fur babies. Yes, two dogs.
yes. One of the, I don't know, the darker side of medicine, perhaps, or patient care, is particularly foreign physicians. But I've had to intervene where the patient says, "Well, I don't want a foreigner to take care of me," and that happens. It does not happen very often, but it does happen. And usually when I intervene, I like, you got to be crazy. This doctor is one of the best doctors that I know and very well trained. And it's really from bigotry, I think. I've never had a patient that was discerning do that. They're but it is disappointing. Have you ever had that experience where patients are like, "Well, I can't see you. You're a foreigner."
Um, I've had my nurses alert me that just be prepared going in the room. I've had some patients, show me the dislike. Um, but ultimately, going back to forming that connection, and I think if when we are seeing them first time, it is definitely challenging. But if you find a little bit of commonality, and if we try to work around what really the patient's culture is and background is, and ignore some of that initial, which is tough, which can sometimes just get you right there, but ignore first of the initial thing, I think you can still manage to build a good relationship.
Uh, uh, you know, um, the listeners should know that all patients love Dr. Sharma. They
Thank
all
you. That
love Dr.
that
Sharma.
must not be true, but thank
No,
you.
that is true. We should all be as loved as Dr. Sharma. But in regards to yeah, our world's a little bit different. We're both hospitalist, and so it's you get your salary and you work your hours and your shifts and that. But they do see a discrepancy in payment, uh, or excuse me, earning between men and women. And I know healthcare is one of those. I've always kind of felt it's kind of like you said, it's part of you take that time off, you take your maternity leave, and that can impair your ability to move along in the system. But it does happen. What are some of your thoughts of why there may be these discrepancies in earnings between physicians, male physicians, female physicians?
Discrepancies in earnings as such. Well, I think I'll start with this. There are a lot of capable women. There's no shortage of capable women workforce in medicine. There's actually increasing and better number of women, female representation in the medical schools and the training programs. But then the women don't go to the higher stages, the high profile ranks, the higher academic places. There's less women who become the deans or the department heads, and very less women who become CEOs and COOs. So that will impact the salary, that will impact the payment and all. And definitely women end up as physicians, women end up taking more time off their work. If they're completely immersed into their work and not taking a time off, they're sometimes perceived, or they can be perceived as neglecting their families, which most of the women with families and children cannot take that. So they end up taking more time for kids. If they have sick kid, usually it's the mom taking time off, and women taking time off. Again, the pregnancies and childcare after that definitely affects that too. And beyond all of that, there are still there are discrepancies there between men and women in relation to the pay in general.
Yeah, to me it's mind-boggling, because we've always had it women on the medical staff that have contributed, and it's disappointing on some levels, actually. Just St. Luke's, I had them look this up for me today. We have 218 female physicians to 197 male physicians on the medical staff. And then if you add in ARMPs and PAs, so obviously ARMPs are predominantly women, but a total of 311 female clinicians and 215 male clinicians. So it's quite a gap there when you add in the allied health providers, but a gap that we're obviously proud of, because they get the job done on a regular basis. Well, Dr. Sharma, it is always a pleasure to talk to you. And I want to thank you for joining me and sharing your story today. You're a wonderful physician and a good friend. Again, this is Dr. Sharma, Medical Director at UniPoint Wound and Hyperbaric Center. Be sure to join us again next month for the next installment of our mini-series, Medicine, Color, Culture, and Equity. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.